Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Matthew Glenn of Topeka about Bell's palsy. Thanks for being here today.
Thank you for having me.
What exactly is Bell's palsy?
Bell's palsy is the sudden onset of either paralysis or paresis of the facial nerve. The facial nerve is one of the cranial nerves which supplies all of the mimetic muscles of the face on one side. Our typical thinking is that the facial nerve becomes inflamed from some cause, and this inflammation causes the nerve to swell inside its tight bony canal and subsequently will cause the paralysis.
And what are some of the symptoms?
People present with progressive paralysis of the facial nerve over a period of several hours up to a day, and this will encompass all branches of the facial nerve going from the eyebrow down to the corner of the mouth. Approximately 75% of the people can have some associated symptoms such as facial pain, a headache, or typical symptoms of an upper respiratory infection.
How is it diagnosed?
Diagnosis is done through a thorough physical evaluation. We will couple that with some testing, which can either be hearing testing to evaluate one of the small muscles in the middle ear space, electromyography, or an MRI, which can allow us to see the course of the facial nerve and demonstrate inflammation.
How is it treated?
The quicker the better. We like to have people on oral steroids and an oral antiviral medication. We know that the faster we can begin treatment, the quicker we can expect recovery. The quicker we start seeing recovery, the more likelihood that people will have complete return of function.
At what point should you call your doctor?
Anyone exhibiting signs of paralysis or weakness of the facial nerve should see their physician to rule out either Bell's palsy or something more serious such as a stroke.
Okay, good information. Thank you for being here today.
Thank you.
Please join us next week for a new health topic discussion on House Calls.